Assalamualaikum warahmatullahi wabarakatuh. We are from Group Alpha and our project 2 is about e-health system. My name is Nurashikin binti Jaafar.
My name is Noorfazeren binti Abdul Aziz.
My name Roaiyu binti Ramli.
And me Nurashikin binti Muhammad.
Okay, the introduction for e-health. E-health is an electronic health system that process or transferring healthcare and health resource through online. And e-health cover three fields, which is deliver health information for health consumer, and lastly, healthcare professionals. And the function of e-health is save and manage medical records by electronics.
So the second is about the user involved. The user involved for e-health is first patient, second nurse, third admin, doctor, hospital staff, outside visitor, and also healthcare professional. So this is how e-health work for doctor or healthcare professional. First, it can enable the communication between healthcare professional about the patient data. Second, it will provide clinical decision support and also enable doctor to share their expertise to other doctors or other personal healthcare professional. The third one is helps healthcare professional teams to collaborate to share information with others. For example, healthcare professional in Malaysia can collaborate with healthcare professional around US or also UK. The next one is works as physical and also psychological diagnosis and treatment to patient via electronic communication. And last one, for how e-health work for healthcare professional, it can monitoring patient health condition. So next one is about the security requirement in e-health. First is system availability. It is to ensure that the best healthcare services by providing continuous accessibility of critical health information to authorized professional, for example, administrator, doctor or healthcare professionals. Next is it is also related to business continuity plan of infrastructure in place and also system integration. So the next one is about lack of interoperability. It is to guarantee that the data transmitted safely through all platform and stage, and on the other hand, that the recipient can use the information received safely in order to use it in future. Next one is access control and authentication. Authentication is the first stage of the user validation to ensure the authorization to access the system. On the other hand, access control policy will define if they are allowed to view or share for organization purpose. So access control is one of the main safeguard that can ensuring the data privacy and also the integrity. If you don't have the authentication or authorization, access control will determine it. The next one is data integrity. It is to ensure the quality and also integrity of the data stored and the data exchange between both sides. Next is network security. It is the next security requirement in e-health, because e-health system is a network-based system. So network is the most important thing need to be secure. Next is security expertise and also awareness. This is the role of the security officer is very important to raise the awareness among their employee. Next one, next one is data loss. It is important to protect the system from involving data loss because this system significantly have a big amount of vital, personal and also confidential data that been stored in digital format. So we need to protect all the data from data loss.
Now I will explain about the access control in e-health. Access control is important features to e-health care information system because access control is to ensure that only authorized users can access to the resources.
Current e-health system is hospital system and networks can be affected as every other's network by viruses, resulting into denial of service attacks and affecting for all operation in the hospital. The diverse nature of healthcare information system enables different devices to access the internet, even though not designed for this, thus making them easy target. Many outdated applications and systems didn't include security as a priority, requiring close attention of the information security officer. And finally, the exponentially increasing attack surface. e-health as a critical information infrastructure. First is healthcare business continuity. examine which asset, infrastructure and services are required to ensure baseline functionality of the entire e-health system and vitality to society. Second is data security and integrity, which is it examine data storage component, network element, for example, access router to a site hosting the e-health application for exchanging health data and identify and access management system IAMS. The third is availability. Availability is a system and services that are directly linked to the patient care as that diagnostic system and intensive care unit ICU and the system that aggregate information related to patient care.
Next, we will continue to see about the threats to e-health security. First, confidentiality. Confidentiality is the act of assuring that sensitive and important data need to be maintained and cannot be disclosed to protect the patient privacy. And for integrity, it is to prevent any unauthorized modification to the patient data or information related to the patient. We need to make sure that the patient health information are not being altered by anyone without authorization. And for availability, we need to ensure that the system can be accessed at any time for critical health information such as network and storage. Then it also need to be handled by authorized personnel in order to provide the best healthcare services. Next one is the nature of threat to e-health. For example, power failure or loss of power supply. This is due to the server down or to no power supply. Second is the network infrastructure failure, such as network congestion or connection failure. The third one is technological obsolescence, which is if the organization uses an outdated hardware or software. For software and hardware failure, the examples are insufficient space for storage and hardware maintenance error. For operational issue, the staff can be lack in training or the documentation for the system is not systematically managed. Next, for malware attack, the system can possibly be attacked by malicious virus, worm, Trojan horses, spyware and adware. Besides that, malicious code can be embedded to the system through the usage of wireless and mobile technologies. The potential attacker to the e-health system. Attacker can be classified into few levels. For example, attacker 1 is the insider who make innocent mistake and cause accidental disclosure. These types of attacker do not aware that their behavior can cause them to disclose some personal or medical information. It could be during the conversation between medical officer in the corridor or elevator. Next, the insider who misuse their record or privilege. These types of attacker are the people who has authorized access to the patient health data but misuse the trust given. They usually seek the health record for a particular individual, preferably someone they formally know. For a level 3 attacker, it is the insider who knowingly access information for spite or profit. It can occur when the attacker has the authorized access to some part of the e-health system but not the whole data, or they do not have the access to the data that they want. The attacker will actually be a billing clerk or any staff at the medical center.
Now we will talk about the assets in e-health system. We have two examples of critical asset, which are first electronic health record system, and second is
e-prescription as system. First component of network connecting the healthcare operators with the EHR system. The impact is loss of availability, which fail to access the information. Identity management system for access control and authorization. Also loss of availability, fail to access to classified information. Web application and database servers. Loss of availability, fail to access application service. For business process and application logic assuring data integrity, it will impact in data integrity, which the data integrity is violate, which means
Okay, I will explain about the comparison between e-health. In Singapore, the objective of implement e-health because they want to cube the escalating healthcare costs, to increase efficiency in medical care, to promote health and to empower Singaporeans to manage their health. For Japan, their objective is providing medical care to rural mountain areas. And Hong Kong, they want to improve healthcare delivery and to make better health information available to healthcare professionals and to patients. And Taiwan objective in build the healthcare system is for managing the development and implementation of telemedicine services across healthcare facilities and levels. And lastly, Malaysia want to implement healthcare system because they want to incorporating effective telemedicine and telehealth, and lastly e-health. So when compared to the 4 East Asian countries, Malaysia seems to fall behind in a few and at far in many important approaches and challenges in implementing EHR system. We summarize from the literature that there are 5 common major challenges in implementing EHR in the 4 East Asian countries, which is the first one, integration efforts. Second is process re-engineering. The third is people, fourth is funding, and lastly is law and regulation. The integration effort are recognized as a major challenge in implementing the EHR in all 5 East Asian countries. The criticality of the challenges differ from one country to another, depending on its health policy, socio-economy, culture, and politics.
As a conclusion, a healthcare system or e-health is an overarching term used today to describe the application of information and communication technologies in the health sector. E-health allows the sharing of necessary information associated with the patient, meaning that only the authorized employee can have access to their patient according to their respective role. However, the security of the e-health system is a key feature to make sure that all of the information, especially the information about the patient, can keep them privately from unauthorized access.